getting to the root cause is what really is going to find long-term quality health, not just putting a band-aid, not just treating symptoms. So what are some of the root causes? And inflammation, we all have heard so much about that, but what does that really mean? So when we check through very advanced blood tests, we look at markers like homocysteine, which is really a sign of what they call endothelial inflammation or irritation. That's the inner lining of our arteries. And when they become inflamed, that's when this oxidative process, this inflammatory process, and it includes that immune response, and that begins the hardening of the arteries. So what we want to do is be ahead of the game. So we check for oxidized cholesterol, but more than that, we're going to check for these underlying processes. Like, are there markers of elevated insulin? Because insulin is going to really begin this process. Again, we want to be preventative. We want to be ahead of the game. So we look for any elevations of insulin, any elevations of blood sugar. These are inflammatory markers. Is ferritin going to be increasing? Now, if it's not anemia, well, then that could be a sign of inflammation. Uric acid, if it's not gout, it could be a sign of inflammation if it's increasing. We want to be preventative. Again, the name of the game is being ahead of these chronic diseases like heart disease and diabetes. There are many years before these diseases become evident on lab tests. Our mission is to be ahead of the game, to be preventative. What we need to do is look at each person uniquely, how they're dealing with the environment, sleep and stress, their nutrients, their foods they're eating. That's what we do here at South Florida Integrative Health Center. My name is Darrell Handwerker. I'm a family nurse practitioner specializing in functional and integrative medicine. We get to the root cause. Our website is www.sfihc.com, and we are here for you. Give us a call at 305-799-1263. Stay healthy.